परम पूज्य सोना रिम्पोचे की दूरदर्शी सोच और प्रयासों से परम पावन दलाई लामा के आशीर्वाद से भारत के टेलीविजन इतिहास में पहली बार शुरू हुआ है एक टेलीविजन कार्यक्रम जो समर्पित है भगवान बुद्ध के दर्शन, ज्ञान और बौद्ध परंपराओं को। कार्यक्रम में दुनिया के तमाम बड़े बौद्ध धर्मगुरु, बौद्ध ज्योतिष शास्त्री रोज आप तक पहुंचा रहे हैं अमूल्य जानकारियां। सबसे पहले देखिए बौद्ध धर्म से जुड़ी महत्वपूर्ण जानकारियां। भारत में 2500 वर्षों से बौद्ध धर्म का वजूद है और देश के हर कोने में बौद्ध परंपरा और संस्कृति फल फूल रही है। लेकिन भारत के टेलीविजन इतिहास में पहली बार नोबल विजडम यानी शराब संगपो के नाम से शुरू हुआ है एक टेलीविजन कार्यक्रम जो भारत की बौद्ध परंपरा और बौद्ध धर्मावलंबियों की ताकत को उजागर करता है। इसी मकसद से पेश है एक और एपिसोड। कार्यक्रम में अगले कुछ दिनों तक आप जानकारी पाएंगे हिमालय क्षेत्र की बेजोड़ पारंपरिक चिकित्सा पद्धति सोआ रिगपा के बारे में। कार्यक्रम नोबल विजडम यानी शराब सैंगपो के पिछले एपिसोड में आपने जाना कि सोआ रिगपा चिकित्सा पद्धति से हाइपरटेंशन यानी ब्लड प्रेशर का बेहद कारगर इलाज संभव है। ये बात सिर्फ मरीज ही नहीं कहते हैं बल्कि लंबे रिसर्च के जरिए भी ये साबित हो चुका है। सोआ रिगपा से हाइपरटेंशन यानी ब्लड प्रेशर के इलाज को लेकर अप्रैल 2009 से मार्च 2010 तक एक लंबा रिसर्च किया गया।
The trial on hypertension was started in April 2009 and was completed in March 2010. Hypertension is the clinical name for blood pressure, which is the force of blood against the artery wall. It is often written or stated as two numbers. The first top number represents the pressure when the heart contracts. This is called the systolic pressure. The second or the bottom number represents the pressure when the heart rests between the beat. This is called diastolic blood pressure.
रिसर्च के लिए 30 से 70 वर्ष की उम्र के मरीज चुने गए और उन्हें सोआ रिगपा पद्धति से ट्रीटमेंट दी गई।
Also include patients who are willing to take traditional Tibetan medicine and treat it on as an outpatient basis while being monitored every 2 weeks. We have also included patients who are willing to strictly adhere to the medicine, lifestyle and dietary treatment for the entire 24 weeks of the trial. Patients who are also willing to sign a written informed consent form to be participated in the research study are included. And the last criteria should be the patient should be with the age range between 30 to 70 years.
हिमालय क्षेत्र की पारंपरिक चिकित्सा पद्धति सोआ रिगपा से हाइपरटेंशन यानी ब्लड प्रेशर के इलाज के जब नतीजे चेक किए गए तो मरीजों में बेहतरीन सुधार देखने को मिला।
Modern DASH diets are favorably recommended our newly diagnosed hypertension cases, our actual drug treatment. The current trial was therefore set up to find out the efficacy of soa rigpa along with the dietary and lifestyle counseling in treatment group and dietary and lifestyle alone in the control group. And it's also to compare between and within the treatment group and control group. No evidence of harm was reported during the trial.
सोआ रिगपा चिकित्सा पद्धति करीब 2500 वर्ष पुरानी चिकित्सा पद्धति है और इसके प्राचीन दस्तावेजों में भी तमाम बीमारियों के इलाज के बेजोड़ तरीके बताए गए हैं। इसलिए ये समझना कि पश्चिमी चिकित्सा पद्धति के आगे सोआ रिगपा चिकित्सा पद्धति कमजोर साबित होगी, ऐसा बिल्कुल नहीं है।
About the dietary and lifestyle guidelines for the hypertensive patients, we have eating recommended diets, and that's eating lots of fresh fruits and vegetables, eating more whole grain products, eating food that are rich in magnesium, and getting adequate amounts of vitamin B and vitamin C, vitamin E are all very good for the hypertensive patients.
सच तो ये है कि पश्चिमी चिकित्सा पद्धति से पारंपरिक चिकित्सा पद्धति सुवारिकपा इसलिए ज़्यादा अच्छा है कि इसमें खान पान और दिनचर्या में बदलाव लाकर बीमारियां खत्म की जाती हैं, जिससे बीमारियां जड़ से खत्म हो जाती हैं। कैसे दूर हो आपके जीवन की मुश्किलें, कैसे सवरे आपका करियर, कैसे सफल हो आपका हर काम, क्या कहते हैं आपकी किस्मत के सितारे। जानिए सटीक होने वाली बौद्ध भविष्यवाणियां।
Namaskar, Teshtelek. I'm Tenzin Jimba, an astrologer from Manzikhan. The following are the daily predictions for the month of October based on Buddhist astrology. 5th October, Tuesday, 27th day of 8th lunar month. The element combination of the day is fire-water. Again, the bad combination of element which could bring destructions and harmful effect to your life. Therefore, only the negative activities may be more forceful on this day. So, better avoid any kind of conflicts with your colleague for your own safety. However, if you happen to do any important activities, maybe you can carry on after 9 a.m. But one must seriously avoid marriage ceremony. 6th October, Wednesday, 29th day of 8th lunar month. The element combination of the day is fire-water. It is very bad day for doing any kind of activities. Only some wrathful activities may be carried on. Besides this, all other activities will bring you harmful effect in your life. You are suggested not to do any medical operation and marriage ceremony till 12 noon because the BT will be running in the morning, which could bring you some harmful effect. You also need to avoid Shabrim and Longje, which means that doing prayers to observe 49th day and the year-on anniversary for the deceased person should be avoided on this day. Thank you. See you tomorrow at same time, same place.
क्या है भगवान बुद्ध का दर्शन, बौद्ध धर्म का गूढ़ ज्ञान, कैसे मिले दुख से मुक्ति, कैसे पाए बुद्धत्व, क्या है धम्मम, क्या है संघम। ये कार्यक्रम आपको हर रोज दे रहा है ऐसे तमाम सवालों के जवाब। आज बौद्ध धर्म के प्रकांड विद्वान परम पावन दलाई लामा से जानिए भगवान बुद्ध का दर्शन और बौद्ध धर्म का सही ज्ञान।
I think those ancient translator, Tibetan translator, really great. And that all these things due to Shantarakshita from Nalanda. He personally was invited to Tibet. Shantarakshita, great master of Madhyamika philosophy and also great logician. All his writing, he always used logic.
Yes. Always used logic and reasoning to establish the point.
So we, as his student, I always proudly to state, we are holder of pure lineage of Nalanda tradition. So we very much emphasize the using logic. So therefore, when I give teaching to Chinese Buddhists, historically they are elder student of Buddha. We are much younger. Buddhism reached Tibet 7th century, 8th century. And China, I think 3rd century, 3rd, 4th century, isn't it? Right. 3rd, 4th century. So they are elder student of Buddha. More than 1,000 years. Tibetan tradition follow strictly Nalanda tradition, study, investigation. So that I think brought a new opportunity meeting with modern scientists. Almost equal way. As far as matter is concerned, external matter is concerned, their finding, their knowledge is marvelous. Although Buddhist sort of literature mentioned about particles and these things, still we learn many useful things from modern scientists. And then inner science is concerned. They found very useful ideas, very useful knowledge, and also some kind of new technique to check, to examine our mind and emotion, and particularly how to tackle emotion. 2 years, I noticed now Buddhism can be divided 3 parts. Buddhist science, Buddhist philosophy or concept, like Paticca that's Buddhist philosophy and also concept Marve. Then Buddhist religion. So Buddhist religion is meant for Buddhist practitioner. But Buddhist science of mind, Buddhist concept is something universal. So academic subject. So I never make sort of effort propagating Buddha Dharma. When I give lecture in a non-Buddhist country, I always stress you should keep your own tradition, traditional faith, mainly Judeo-Christian faith, and to some extent Islam. So it is much safer and better to keep that. Whereas like Tibetan and Mongolian, and also I think many Chinese traditionally Buddhist, and Korean and Japanese, and of course in these Buddhist countries, like that. It is our traditional religion, so better to keep that. Oh, I have one sort of nice story. You know, in early 60, when Tibetan refugee community freshly arrived refugee, very difficult. So many of them, there's no other way to earn but just simply road work. So very difficult, especially some of those some of these Tibetan who come from the western part of Tibet, they also brought with their family, including their children. So at that time, children suffer very much. Climate change and because of malnutrition, these things. So one Tibetan family, the husband, Tibetan official, lay official. Then the father, official, passed away. And mother, his wife, and I think 2 or 3 children remain. So very difficult. So then some Christian missionary, at that time, of course, many Christian organizations, they provide food and milk, and many things. So the early period, of course, besides the government of India should help, the Christian organizations help, immense help, very helpful. So that family also received some help. So then, I think 63 or 4, around that period, she came to see me, and she told me her stories. Then she told me, Christian missionaries, not only help them, other facility, but also, you see, take to school her children. So then he mentioned, so therefore, the Christian missionary is very, very kind to her. So for this life, she become Christian. Now next life, she will be Buddhist. So what is that? This is a clear sign of confusion, isn't it? So it is much better to keep one's own tradition. So I never sort of propagate Buddha Dharma in different sort of country. But you see, as far as Buddhist science, in order to develop more compassionate mind, more compassionate person, I always is telling, as a secular ethics, then promotion of religious harmony, I always do. And recently, I was in Vancouver, and then finally, Quebec, Montreal. A serious discussion how to introduce the compassionate ethic in modern education system. So there, when I was actually, they invite one organization invited me. That mainly at that time they carry some teachers training. Many colleges, universities in Quebec area gathered, I think, few hundred teachers. They carry teachers training. They mainly, you see, without touching religion, how to introduce, how to teach children or a student about the importance of compassion, moral ethics. So like that. So these are, I think, from Buddhist science or Buddhist concept, you see, can make some contribution. That I do. Otherwise, I never sort of trying to propagate.